Hello, everyone. My name is Ashley Slight. I'm an associate with Constant Associates, which is a health security and healthcare preparedness consulting firm. We are based out of Torrance, California, and we specialize in putting together training, assessments, exercise, and plans specifically for healthcare related to emergency and disaster preparedness. And what we would like to do today is to really help you see the value in participating in a healthcare coalition and what this can bring to the table for your facility or facilities in terms of meeting the new CMS Emergency Preparedness Rule requirements. So we will walk through some tips for successfully implementing, participation and membership in a healthcare coalition. And we'll walk through our objectives in a moment here, but I'd like to introduce my colleague, Christopher Riccardi, who will also be on this journey with me today.
Greetings. Thank you for having me. I appreciate the opportunity to be able to share some information with you in revolving around healthcare coalitions and to see how this would be a benefit to all, at least most, if not all.
Okay, so I will introduce the goals and objectives of this webcast in particular. We really want to leave you today with not only an understanding of what a healthcare coalition is and what it can offer you, but also what can your facility or facilities offer back to the healthcare coalition, and leave you with some talking points for communicating with your senior executives about the benefits of joining. We realize a lot of you are not necessarily full-time emergency preparedness employees at your facility, and your time is really valuable. We want to make sure that you have the support you need to attend healthcare coalition meetings and to really validate that time and effort to your senior executives or your senior leadership, and to maybe involve some of your other staff at your facility. We always find that's a wonderful way to get people engaged. So we'll talk about each of these things in turn throughout the presentation. So with that, first I want to offer just a couple of resources related to the overall CMS Emergency Preparedness Rule. For those of you who want more information about the requirements themselves, there's a list here of a couple of other webinars and presentations that go into a lot more detail about the requirements. One thing that you may note here is that CPCA did a previous webinar with Chris and myself on the training and testing component. So that link is listed here. There's also another webcast that we did related to the risk assessment, policies and procedures, and communication plan components of the rule, with some tips for implementing those. Those will also be up on the CPCA website. So you can go to their emergency preparedness page, or here they have their cpcaevents.org for the webinar. Then there's just a couple of other links to the Federal Register page and the CMS page itself, where all of their interpretive guidelines and requirements are listed. So with that, I'm going to pass it back to my colleague Chris to walk you through Healthcare Coalition.
Greetings again, and hopefully you'll enjoy part of this journey as well. The Healthcare Coalition portion of this is to determine, well, one, what is a coalition? Two, what are the benefits of being involved in a coalition? What does it look like to be part of a coalition? And the resources that you may find that are available to you as part of your engagement in these community structured coalitions. So with that, what is a healthcare coalition? Well, these basically appeared over the last 10 years or so in various forms as group of local healthcare and responder organizations collaborated to share tools and resources to respond to emergencies. That we are not preparing for disasters or adverse events just in silos. So to bring in a holistic approach by bringing in our community partners and the healthcare organizations that are contained within the municipalities or the jurisdictions of these coalitions. It's defined as a collaborative network of healthcare organizations and, of course, their respective public and private sector response partners. They're often driven by the Hospital Preparedness Program, or HPP, which has been out and about for about the last 15 years or so. And this is a division of ASPR, or the Assistant Secretary of Preparedness and Response. The HPP provides leadership and funding to states, territories, and eligible municipalities. We happen to be fortunate living in Los Angeles County, and how they were able to manage through the HPP program here has been a model for other states and other cities to work around. So as we move on, what does this funding stream look like? Well, it starts at the federal level, the purple box at the top, and it will then get divvied up to the states. There were, I won't get into the details of the HPP program, but there were some cities that were treated, or counties that were treated as separate states because of population, and hospitals and various other healthcare facilities that were located within those regions. And then you'll see that it trickles down into your jurisdictions where you have your public health and your emergency management, public safety, then down to the medical support aspect of this, and then your healthcare facilities, whether it be the hospitals, the clinics, what does that look like in your communities? And then you have your non-healthcare facility organizations. What would that necessarily be? Some of your community bases. Maybe you have folks within your jurisdictions, within the cities, that do require funding or tools that they would be able to implement as a result of this federal funding. So that said, just to give you a little overview of what this looks like, and you'll notice that everything is color-coded from, with the emergency management programs, your emergency operations, into all of these tiers. As you go through these things, where you fit into this, my assumption is that you'll be in a healthcare facility of some denomination or another, and how you integrate into the group at large. So maybe you are a clinic that is under a hospital's jurisdiction. Well, you would then tap into part of that hospital's funding to ensure that you have whole community-based planning and preparedness tools in place. And I don't want to belabor this fact, but you get a chance to see as to how the trickle down of funds works in this model. So what does a membership look like? What does it cost? Well, one, Healthcare Coalition membership should be free. I'll just put that out there right now. If somebody's trying to charge you money for that, then maybe you need to look to a different coalition. I say that in jest, but I just want to give you tools to equip you for what you may need to do while you're out there. The membership of these coalitions usually are healthcare, your hospitals, your public health folks, your emergency services, and your EMS agency within your community. Maybe you have different cities that have jurisdiction within that realm. Like here in Torrance, our local hospital is the receiving facility for the beach cities, Redondo Beach, Hermosa Beach, Manhattan Beach. So when we do our planning, we cannot just focus on the city of Torrance's fire department, but need to incorporate those that would have an impact on our facility as well. So in your other healthcare organizations, which are now probably getting a little bit more of a foothold within these coalitions, are your dialysis centers, your community clinics, your behavioral health, long-term care facilities, ambulatory surgical centers that are out there as well. You are now being tasked with being involved in your local coalitions for your community-based exercises. And you'll see as we move on into this, the benefit of being involved in that coalition. Now, I can tell you from my perspective that the local coalition meetings, or our disaster resource center is what we refer to them here, are 2 hours in length, and they happen once every 2 months. So it's not a very big time commitment, but the resources that would be obtained by being as part of this coalition will prove to be invaluable in your community planning and how you share these tools and resources within your communities. And again, having these meetings when we are not in a time of disaster or an adverse event, to be able to share resources. And one of the neat things about being involved in the healthcare coalitions is that these folks are willing to share materials and resources freely. That, and it's give or take, so you may have something that may benefit them, but chances are that you will be able to tap into those resources for whether it be best practices or maybe even finding certain responses that have happened within their facilities that didn't go well, which is actually probably a little bit more valuable to many. So be at the table, share your information. It is a great resource to be included in, and I think you will see that it will perpetuate your programs exponentially by the resources that are around that table and the various levels of expertise. And they go from all the way from subject matter experts to folks that have just gotten into emergency management. So don't be intimidated of joining into this, because at any given time, anyone around that table was the new guy or the new gal at the table. Okay, so let's get into some of the structures and what this looks like. So this is they often develop around naturally around existing partnerships. Maybe it is your EMS and health and hospital or ambulance companies or fire departments. These are natural fits. These are natural partnerships that take place every day within our communities. How do you tap into that? By attending the meetings. But you'll see that this has been, that many of these have already been developed, and it's just up to you to get into one. And we'll get into a few of those as well. Could be based on delivery service of delivery areas or funding streams. They could cross county and jurisdictional lines. Just because you're in a county does not necessarily mean that you can't, if you're closer to the next county, or maybe even to the next state, as if many folks up in Northern California, like the Tahoe area, there are resources that are just across the border that may be closer to you than trying to tap into certain things that are in the state of California. But you can't be in both. So that's another topic, but that's something else for you to do a little homework on and find out where and what is the best fit for you.
Yeah, you can't necessarily go out there and be a member of 4 or 5 different coalitions and see which one you like the best. You may want to do some thorough research, as Chris said, before you make a commitment to one.
And these are all great points. And some of these are going to be headed up or led and organized by your HPP coordinator within the county or the local health department within those jurisdictions. So you may find that there are already services available to you that are just outside your door. You just need to tap into that. And it could be something as simple as asking a hospital partner as to where do they attend their coalition meetings, and they'll be happy to provide you with some guidance. Some have self-governance structures, bylaws, etc. Some, depending on the funding and size, have salaried positions that head up these HPP programs. I know there are a couple of counties that border Los Angeles County that have full-time HPP coordinators within those realms. And some are actually functioned as a 501c3, a not-for-profit that is designated as such. And you start getting into, like Citizen Corps and various other things that you'd be able to encompass your healthcare coalition folks. Now, ASPR Tracy is another great resource to tap into for a host of information. ASPR, again, is the Assistant Secretary for Preparedness and Response, and your Tracy is an acronym for Technical Resources. You're holding me to task here on the AC and Information Exchange. I apologize for that, but there are a host of things that go through our heads with acronyms. And moving on into, so what do the activities look like? Well, regular meetings and conference calls, as I mentioned. They host joint training opportunities, and again, for community-based training, as is a mandate by CMS to be involved in. This could be a great put-in for you, or a great way to satisfy that requirement. You create informal agreements or MOUs, Memorandum of Understanding, between its members, so that you have already had the discussions as to how you would share resources. You can plan, implement, and evaluate your exercises together. Perhaps you evaluate another event taking place in the community to help strengthen your own plans, or you do this jointly as collectively. Advocacy for promoting emergency management throughout. Public awareness, your outreach, messaging. Your HPP folks may already have some type of messaging system that you would be able to tap into to message your staff. So again, there may be resources that are untapped resources that are out there that may provide you with a whole lot of comfort in your planning process by just tapping into it. Again, I told you we could share best practices, documentation, templates, and again, some review and approving and approved funding allocation strategies. So perhaps you are a health clinic that need, let's just say, an AED to help your facility in the event somebody has a cardiac event in your hospital or in your healthcare facility. And you may need some AEDs within the community. Maybe you're in a rural area and that would be beneficial to you. Perhaps you would be able to tap into that with some of your, as an HPP event. And that is not necessarily to be prescriptive, but just to give you ideas as to what that could look like. So I'm going to get into the next step of this, which is the total number of healthcare coalitions by awardee. And you'll notice the number of coalitions that are in the state of California. There are 57 of these in California, 22 in Texas. You can see 8 up in Washington, 7 in Oregon. Not sure where you're located, but there are 4 in Nevada. One of the things, and I haven't been able to get the answer to this yet, as to why there are 57 healthcare coalitions in Iowa. Ashley and I have been having this conversation since we put this slide deck together. And I'm still waiting to hear back from some of the folks out there as to why that is, or if this is just a misprint. But apparently that's a whole lot of coalitions that are available to you here in the state of California as well. Okay, understand that they will cross county and jurisdictional boundaries, but tap into the one that is most advantageous to you. So what does it take to become a coalition member? As I've alluded to as I've been going through this presentation, finding your local coalition. Check the CMS Emergency Preparedness Rule site. They have a state-by-state coalition listing. So you're not necessarily having to go and do cold calls to find this, but to just look into the resources that are already available. And the website is here in the slide deck. If a coalition is not listed there, contact or if a coalition is not listed that would be in your jurisdiction, contact your local HPP coordinator or your local health department. And if there is currently no coalition in your area, perhaps you can join one across county lines, as we had mentioned, or coordinate with your local health department to perhaps create one, and now you will be that coalition leader. And I think you'll find that the advantages of either being a member or a leader will be incredibly beneficial to you and your organization. And now, once you've determined your coalition, attend the meeting, introduce yourself and your facility, and bring staff whenever possible. Again, many folks have one representative that they send to these meetings. Well, what happens if you're not well, or you're on vacation, or you're unable to attend for whatever the reason? You definitely want backup, and you want others to know the plan within your jurisdiction. All of this information cannot sit with one person. The idea to disseminate this information out to your facilities, to empower your folks, to develop a support system within your organization, to be able to be actively engaged in your community as well. And you may find that the more folks with knowledge of this process will help create a stronger emergency management plan within your own facility. So utilize the tools that are available to you and reap the benefits that are available to you.
And if I can add to that, Chris, it's a great way, too, of generating buy-in at your facility. If you are having a tough time arguing with your senior executives or the rest of your team as to why emergency preparedness is a priority, why we need to do something like this, bring them to a coalition meeting. It's a great way for them to see that other facilities are committed to this, that other facilities have the same or other issues that they haven't even thought of yet. And we've heard stories from clinics that, they will rotate their staff to attend these coalition meetings, and their staff will come back to them and say, that was really interesting. I want to know more about this. Can I get involved? and there's some additional labor hours and some buy-in for you to use later.
And we'll cover a little bit more about bringing this up to your executive team towards the end of this presentation as well. But again, we'll just go on into the jurisdictions with multiple coalitions. Again, some of them are based on the service area, facility type, your politics, personalities. There are a host of things that color in the lines within your jurisdictions. But identify ones that work well and find the right fit. You may need to attend a different meeting, one meeting here, one meeting there, to determine whether or not, consider it coalition shopping. If you have the opportunity to find one that's a better fit for you, by all means, do so. But I would also encourage you to step outside some of your comfort zone to go get involved in a group that may not necessarily have been the folks you would normally spend time with to help grow your program, grow your level of knowledge in areas of expertise as well. So just because it may not fit right now doesn't mean it may not fit 2 years from now or a month from now, just depending on what that may look like for you. So utilize the resources again. And again, if the current coalition doesn't work, consider creating a sub-coalition or something that then you could develop within your own jurisdiction and then report up to the larger coalition at large. And get involved with your other clinics, healthcare organizations. I'm sure you have a host of folks that work within your facilities. And I would also strongly encourage, that you try to get some physician involvement in part of your disaster planning, your emergency management plan. And I can tell you a great resource just from my own personal past is having a physician involved in your planning adds a little extra credibility, but also gives a clinical aspect, a little bit more clearer clinical perspective as to how these coalitions can work to your advantage. And with that, I am going to pass this on to Ashley to get into the coalitions and the CMS rule.
Perfect. Thank you, Chris. So let's talk a little bit about the CMS Emergency Preparedness Rule and how this plays in currently with the healthcare coalitions. So the rule, as for Tracy even put this up on their website, the rule offers healthcare coalitions and newly engaged providers a tremendous opportunity to achieve greater organizational and community effectiveness and sustainability. So even though the HPP program and healthcare coalitions existed prior to all of this, prior to the CMS Emergency Preparedness Rule, these two programs really can integrate very well together to achieve the same goals. The CMS Emergency Preparedness Rule is ultimately about increasing patient and staff safety during and after a disaster, and it's about increased community resilience. And the healthcare coalitions can get you there. Every part of the CMS rule is something that healthcare coalitions already have been working on up till now. So a quick note about financing. So HPP grant funds cannot be used solely just to meet CMS Emergency Preparedness Rule requirements. But HPP grant funds can be allocated to individual healthcare facilities within their coalition based on a need, and as long as that activity advances system-wide preparedness. So as Chris mentioned earlier with an example with AEDs, let's say your community or your group of facilities needs a supply of AEDs, and you're not able to obtain them through your own budget or funding stream. If you go to your coalition and if there is an express need for these AEDs or some other type of equipment or some other supplies, and that's something that's going to contribute to the preparedness and resilience of that community as a whole, and the coalition agrees on that and moves forward with it, those HPP grant funds could be allocated, at least in part or in some program, to your facility for that need, and that will help you meet that requirement for your CMS conditions of participation. So really, healthcare coalitions have a vested interest in helping you to meet your CMS emergency preparedness requirements and vice versa. Your healthcare facility has a vested interest in using and participating in the healthcare coalition to make sure that both sides are achieving their goals. And most healthcare coalitions have already gotten a head start on this rule. Ever since it came out, and even before, the healthcare coalitions have been watching this rule since it was open for open comment a couple of years ago. They've already started offering trainings. They've already started outreach campaigns to get community clinics, dialysis, surgical centers more involved to increase participation. Most of them hosted either a training or a webinar or some sort of workshop specifically on the CMS Emergency Preparedness Rule and what it entails. And most of them have annual drill or exercise programs already in place to meet other grant requirements that can easily be utilized for that annual exercise requirement for the CMS Emergency Preparedness Rule. So that's definitely something that you want to take a look at. A lot of them have also started working on document templates for an emergency plan. They may even already have a resource directory of all the contact information for your local partners. And that would be wonderful to just take and copy and paste directly into your communications plan, and it will ultimately save you a lot of time and energy. So as a clinic, you may want to start by asking for assistance from this coalition with some of the following things. Getting access to their hazard vulnerability assessments, or their other facility risk assessments. Sometimes the local jurisdiction has what's called a threat and hazard identification risk assessment, or a THIRA. Ask for access to those documents. Those can be invaluable in informing your own risk assessment or helping you start 80% of the way through a risk assessment rather than creating everything from scratch. Ask them about regional training opportunities and exercises that you can include for this next year. Ask them about best practices or knowledge that they may have on how to plan an exercise at your facility, how to get staff involved. Ask them to review your plans and policies and procedures and provide feedback. And ultimately, ask them about what their capabilities and resources are for a disaster so that you can consider those when you need something during or after a disaster. Maybe your facility doesn't have AEDs, as we mentioned with this example, but maybe another facility close by that's in that coalition can offer you some additional supplies or some feedback on how to obtain those, or some feedback on funding streams that you might be able to utilize.
And if I may interject, one of the things that we had found being out in the community is that some clinics are part of a greater disaster response plan, and the clinics had no idea that they were involved in that process. So by being at that table, we'll also identify where there may be gaps in the planning process, et cetera, et cetera.
That's a great point. There's a lot of local jurisdictions out there who are planning on utilizing their clinics during disaster, and it would be nice if you knew that ahead of time, that they'll be knocking at your door. So then what is the opposite of this relationship look like? What can a clinic bring to the table to offer to the coalition? So we, as Chris says, we like the 3 S's: space, staff, and stuff. So you can offer space to host meetings. A lot of coalitions will rotate, where meetings or trainings are located. You can offer medical supplies and resources that could be requested from another facility in a disaster. So you can offer input on what your capabilities are. Maybe if there's an active shooter event at a clinic that's a couple blocks from you, maybe they can utilize some of your resources and they'll know who to reach out to. You can help with medical surge, minor injury treatment, maybe initial screenings for higher acuity. You're a valuable resource within the community. You also have volunteers and staff who are trained and who are a vital resource that can be requested during a disaster. You can also offer broader exercise participation. In a lot of these regional exercises, they want as much of the community participating as possible. And if you're willing and able to come to the table and to plan and participate actively, that is a huge asset to them. And finally, there's something called a point of dispensing site. This is usually a program organized through the local health department where they may store pharmaceuticals or medical supplies either ahead of time or during disaster. They may deploy extra supplies to specific sites within the community when they're trying to reach the public. And you have an audience, you have a dedicated patient population that they can reach by using your clinic as a point of dispensing site or by using your expertise in your local communities. You're a vital asset to them and can offer things like immunization clinics or trained nursing staff who can give vaccinations, that sort of thing. And overall, just community support and having another point of contact and another resource and the trust of your clients. These are all valuable resources. So I'm going to pitch it back to Chris to talk a little bit about communicating with your executives about all of this.
So, if in fact, thank you, Ashley, if in fact you are not a healthcare executive within your facility, having to manage this up and bring this to the attention of your executive team can be a little bit of a daunting task. And and I'm going to throw this little caveat out there right now, that unfortunately there's no return on investment for money that you spend in emergency preparedness. But if in fact you did have to respond to that event, you could not have spent enough money for your preparedness. So how do you justify, as I was mentioning about communicating with executives and managing this stuff up, it may be within our realm to have to express the benefits and sell in working with a coalition to your hospital executives. But one of the nice things is that really the only expense to being involved with a healthcare coalition is perhaps the time spent at these meetings, because participation in these programs is free. Shouldn't cost you a dime other than travel and travel time to and from these meetings and the time spent at these meetings. But the additional benefits are sharing knowledge, and we tried to emphasize that a little earlier in the presentation. But there is a whole lot of information, and there's a host of folks that are out there that have the knowledge to be able to assist you on your journey. Potential access to funds if you are participatory in this. So instead of it costing money, you may actually be able to bring in some supplies. Access to shared resources, expertise, your regulatory and accreditation requirements as part of that coalition and sharing information. Ad hoc memorandum of understanding. Again, this is by being part of that coalition, you are establishing a memorandum of understanding and sharing resources together to assist one another in being a holistic approach to emergency management. Training for other staff members, perhaps one of your other folks within the coalition are hosting training that would then be open to your coalition. So it doesn't even need to be conducted by you, but you are able to participate in and advance your level of knowledge and skill. Improves patient safety, improves efficiency, and it goes beyond just being compliant, but exceeding compliance. And by being a part of a coalition, you will help to become a little bit more financially resilient, because anything that's happening in your community is not just going to be solely funded by you, but within that coalition. So you may find that by establishing minimum specifications for your facilities or finding what other folks are utilizing, you may find that it may not cost you anything on the front end of being able to be prepared for a disaster. So understand that your financial resilience in going through this stuff, again, will hinder and will be also part of your membership in that coalition. So let's give you a couple of tips. As we mentioned before, you're probably going to feel a little overwhelmed in how you're going to take this on. We have a little expression that how do you eat an elephant? It's one bite at a time. So no matter how large the task, if you take those first steps, we'll get you on to the next step and we'll guide you to the next. But again, being part of this coalition will help you to give a little bridge over a couple of those little spots, because some of the tools or some of the forms or some of the resources may have already been developed that you'll be able to adopt and implement into your program. You get to engage other staff members to attend these coalition meetings as well. I found that one of the best ways to get some of my folks out, where after the meeting, I'll take them out for lunch. Maybe we'll get a cup of coffee if lunch is a little bit more than your budget will withstand. A cup of coffee is always doable. And even just to get out and stretch your legs a little bit, it's never bad to change the scenery periodically from your work environment. And again, to increase your level of knowledge, it's time well spent. Politics can be messy, so be aware. There may be things that take place around that table that you're going to sit there with shrugged shoulders wondering, what am I doing here? Well, understand that that's not necessarily every meeting, but just ones that would, that maybe that is the subject that's being addressed at that particular moment. But by you being a voice at that table will then start to wag the dog, so to speak, that your needs will be addressed and at least be shared so that they can be addressed. And again, membership and your participation is somewhat of a long-term investment. Don't expect to get everything done or everything that you need out of this in 3 months. This is something that you will, as this program develops, as your program develops, and your level of knowledge increases, you'll start to see that each step of that way, there'll be new questions that pose to this group. You'll have new needs or new identified needs that you would like to incorporate into your environment. So utilize this as a tool, utilize this as a resource, utilize this as a way of not having to reinvent the wheel, by being able to tap in. You know what it feels like when you find the website that you're looking for information and bam, you have this plethora of information before you. Hopefully you'll find that these coalition meetings provide you with some of those moments as well. So we'll move on into some of the resources that are available. Your healthcare coalitions, how you can tap into from the Department of Health and Human Services that I mentioned before. Your healthcare coalitions, and there's a governance and sustainability webinar. You'll see that the links that will get you to National Healthcare Coalition Resource Center and conferences, developing a healthcare coalition from public health. You're going to find that there is a host of materials and things that have already been done out there. There's also a CDPH in the state of California here, for cdphready.org, that has executive briefing toolkits as to how you can bring this stuff up. And I tell you true that when you start to manage this stuff up to your executive team, you will start to find that you may be empowered to do more things, and you will then be looked to as the subject matter expert. So be a vital link in that chain of preparedness and response. Be the leader in your organization. Rally the troops. Bring them to your side as you move this stuff forward. And I'm going to give you another little key as finding somebody to bring out to assist you in these meetings. Find folks that have a passion for this within your facility. You may have folks that are already CERT trained or have other layers of expertise. Maybe they came from a hospital setting. Maybe they came from a fire department. You're going to find that by interviewing that group, that you may find that you're going to have a whole lot more resources than you actually thought you may have had originally. So with that, I would like to say thank you. Thank you for the time. Thank you for the opportunity to share some knowledge and information with you, and to share the resources that are available to you. So from me, thank you very much. And with that, I will let Ashley pass that along to Ashley.
Yes, thank you, Chris. Same here. Thank you, everyone, for letting us have an opportunity to go through a couple of our tips and best practices. As always, Chris and I are available anytime for questions, concerns, thoughts, comments. And on our website, too, we actually have a series of webinars that we put on. We always record them and put them up on our website on various emergency preparedness topics. So if that's something you're interested in, take a look at that. Highly encourage you to look at all of CPCA's tools and resources. They really have done an amazing job of getting everything ready for all of you so you don't feel quite so alone with all of this. So thank you, everyone, for letting us take a part of your day, and have a great rest of your day.
Thank you again.